Surgery for TMJ disorder. Surgery for TMJ disorder, what should you expect? Recovery process you should know after surgery for TMJ disorder. It depends on the person and the type of surgery performed. Most TMJ surgeries are outpatient procedures, which means you'll be able to go home the same day as the surgery. Make sure someone can take you home the day of the surgery. Since you might be a little woozy or unable to focus, which are side effects of anesthesia. For your work problems when having surgery. You don't necessarily need to take more than one day off if your job doesn't require you to move your mouth a lot. However, if possible, take a few days off to allow yourself time to rest. After the procedure is done, you may have a bandage on your jaw. In addition, your doctor may also wrap an additional bandage around your head to keep the wound dressing secure and in place. What to do after TMJ disorder surgery? For 1 to 2 days after the surgery, do the following to make sure you recover quickly and successfully. Take non-steroidal anti-inflammatory drugs, NSAIDs, for any pain if your healthcare provider recommends it. NSAIDs are not recommended for people with bleeding disorders or kidney issues. Avoid solid and crunchy foods. These can put strain on your joints. So, you may need to follow a liquid diet for a week or more and a diet of soft foods for 3 weeks or so. Make sure you stay hydrated after surgery. Apply a cold compress to the area to help with swelling. The compress can be as simple as a frozen bag of vegetables wrapped in a clean towel. Warm heat applied to the jaw muscles may also help with comfort after surgery, such as heating pads or microwaving a damp cloth. Cover up your bandage before bathing or showering so it's watertight. Regularly remove and replace bandages. Apply any antibiotic creams or ointments your healthcare provider recommends every time you replace the bandage. Wear a splint or other device on your jaw at all times until your doctor tells you it's okay to remove it. Seeing your doctor often after surgery is better. See your healthcare provider 2 to 3 days after surgery. To make sure you're healing well and to receive any further instructions on taking care of your TMJ. Your doctor may also need to remove stitches at this time if your stitches do not dissolve on their own. Additionally, they may recommend medications for pain or any infections that arise. You may also need to see a physical therapist to help you regain motion in your jaw. At the same time, prevent swelling, as it restricts your TMJ movements. A series of physical therapy appointments may take several weeks or months. Of course, you'll usually see better long-term results if you work closely with your therapist. Complications can occur after surgery for the TMJ disorder. The most common complication of TMJ surgery is a permanent loss in range of motion. Also, other possible complications include persistent pain or limited range of motion, infections around the surgical site during or after surgery, injury of facial nerves, sometimes resulting in partial loss of facial muscle movement or loss of sensation, damage to nearby tissue, such as the bottom of the skull, blood vessels, or anatomy related to your hearing. Frey syndrome, a rare complication of the parotid glands, near your TMJ, that causes abnormal face sweating. Surgery for TMJ disorder, TMJ pain may come back. TMJ pain can return even after you've had surgery. With arthrocentesis, only debris and excess swelling is removed. This means that debris can build up in the joint again, or inflammation can reoccur. In addition, TMJ pain can also return if it's been caused by a habit like clenching or grinding your teeth, bruxism, when you're stressed or while you sleep. If you have an underlying immune condition that causes tissues to become inflamed, such as rheumatoid arthritis. TMJ pain can come back if your immune system targets the joint tissue. Ask your doctor for problems. Before you decide to have TMJ surgery, ask your healthcare provider. How constant or severe should my pain be before I have surgery? If surgery isn't right for me, what activities should I avoid or do more of to help relieve my pain or increase my range of motion? Which type of surgery do you recommend for me? Why? Should I see a physical therapist to see if that helps first? Should I change my diet to exclude hard or chewy foods to help with my symptoms? Are there any complications I should think about if I decide not to have surgery? Advice: see your healthcare provider or dentist as soon as possible when your jaw pain or tenderness is disruptive to your life or when it prevents you from eating or drinking. You may not need surgery if non-surgical therapies, medications, or lifestyle changes relieve your TMJ pain. Surgery is often a last resort for the most severe cases, and it doesn't guarantee a cure. So, let your healthcare provider know if more conservative treatments aren't helping or if your symptoms are getting worse. Reference: Free solution for TMJ disorders. Link in the description. Or refer to 247naturalhealth.com to all information about chronic disease. In particular, if you know Qigong and its miraculous improvements to health, visit falundafa.org. Thank you. I hope you're always happy and healthy. Thanks for watching. Don't forget to subscribe to the channel to receive useful information.